Hi, everybody. Can you hear me okay?
Yep. Good.
Okay, good. Thank you so much for being here. I'm excited to talk with you. I am having a baby in August, so if you're kind of wondering, just take that off of one of your burners. It is true, so it will be my second. I have a 2-year-old as well who's at home terrorizing Dad, I'm sure. So thank you to him as well for letting me be here. So I was working with a particular lady who had been an avid walker. She was a grandma, loved taking care of her grandson. She was just really active. Walking was something she did with a lot of her friends. She loved being outdoors. But she had stopped most of these activities, partly due to fatigue, but also due to not really being able to feel her feet or know exactly where they were. They were tingly. She was just afraid of falling and afraid that walking wasn't safe and that carrying her grandson around wasn't safe. So she kind of started doing less and less, and that made her more and more afraid as she wasn't practiced in doing some of those things. She was kind of depressed because she wasn't doing the activities in her life that gave her life and made her excited about her day. So that's kind of where she was at when we first met. And we started working on some pretty simple foot, leg exercises, just kind of increasing her awareness of where her feet were, strengthening some of those muscles, doing things in the clinic to actually start walking again, start doing some of these things that she was excited about. And it was a gradual process. It took a lot of time, but as she built up confidence again, as she built up strength again, that snowballed in the opposite direction that it had snowballed previously. And she found herself doing more and more, actually got excited about a water aerobics class at the Y, developed some new friends there, and was just enjoying her life more. So that was really exciting. She was able to hold her grandson again and even walk with him up and down the stairs, which was one of her main goals so that she could watch him. She still had some foot tingling. She still couldn't feel her feet quite as well as she had before, but she had the confidence and the skills to know that she could use different strategies and not fall down as she was walking around. Really just trusting her legs and feet more. So that's one story highlighting a couple of general strategies. I don't know each of your stories, but I'm sure each of you has things that you're excited about, things that bring you life, that you want to continue doing, induced peripheral neuropathy. And we're going to talk about some evidence-based strategies, either that you can just do on your own or things that skilled physical therapy can help you with. So that's our goal for this morning. Certainly if you have questions in the midst of the presentation, feel free to ask. Otherwise, we'll have time at the end for questions as well. So, that's different. Let's see if it's the next one. Nope. All right, well, I have an extra slide. I don't know if you do in your presentation. But basic facts about chemotherapy-induced peripheral neuropathy. This slide, do you guys have this slide with all the, okay, good, because it's got a lot of numbers, and I don't necessarily want to go through all of them, but kind of like Joette was saying with the chemo brain, these ranges are really wide, but the numbers are high. I mean, this one for the platinum-based is 28 to 100% of people can be affected by chemotherapy-induced peripheral neuropathy. So it's a big problem. We haven't been talking about it a lot, but it's becoming more and more of a topic of conversation just because it does affect so many people. And the point at the bottom, it can be bothersome enough for patients to quit their chemotherapy. So you're doing this treatment that's getting rid of the cancer, saving your life, but yet this peripheral neuropathy can be so debilitating that you need to change your treatment strategy. So it's a big deal, and it's affecting a lot of people. Now we can go to this next one. So why does it happen? The exact answer is we're not quite sure. Again, this is an area of research that's being researched. But nerves love blood. They're susceptible to the chemo drugs, partly because they are so hungry for blood and need that in order to do their job. So once we get into the brain, the spinal cord, you're protected from bloodstream. There's this barrier, so there's less ability for the chemo to get there, fortunately. But especially further away from your spinal cord, further away from your brain, in your hands and feet, it can be affected. So how exactly does this work? There's a lot of theories. Studies have focused really microscopically and found damage to the way the nerve gets energy to the mitochondria. Some studies have focused on the communication along the pathway, maybe damaging DNA within the nerve. Certainly true that the longest nerves, tips of your fingers, tips of your toes, are the ones that are susceptible to this damage. But again, theories, it's an area that's being actively researched currently. So what exactly is it? Numbness, tingling, and pain in your feet, most commonly, but also can be in your hands. So your nerves control your sensation. They control your temperature. They control your muscles. So usually it's affecting more of the sensory things, that numbness, tingling, what you're feeling, versus your muscles and the motor weakness. But if you can imagine, if you can't really feel your feet, or if they're painful, if they're tingly, you're not going to tend to use them as much, and those muscles are going to grow weaker just because of that. You might have trouble walking if your feet are really painful or if they're tingly. And then the last thing that seems to be a little separate but is part of this constellation is chemotherapy-induced autonomic dysfunction. So basically fainting if you sit up or move, stand up too quickly. So talking about falls risk, it is common even just within cancer population. We've got this 11.9% of people who had finished chemotherapy within the last month had actually fallen within the last 3 months. And 26%, so almost double that, felt like they were limited in their ability to do things because of decreased balance. So we could kind of draw a Venn diagram. There's the chemotherapy-induced peripheral neuropathy, there's falls, there's a lot of overlap between this group. And as a physical therapist, focusing a lot on preventing falls and strategies for improving function, decreasing falls risk is sort of where I'm working, so where this presentation focuses a little bit. How do they diagnose chemotherapy-induced peripheral neuropathy? Well, you have to have had chemotherapy. There's other types of peripheral neuropathy, and people who are cancer survivors, of course, can get other types of peripheral neuropathy, but we're going to focus on chemotherapy-induced today. It tends to be, like I said before, the sensory, what you're feeling, more than the motor symptoms, and it tends to be stocking and gloves, so like what would cover a mitten or a sock, and again, feet more than hands. If it's caused by the chemotherapy, if you get more chemotherapy, you should get more symptoms. So they can use EMG to test your nerve conduction. How well are those nerves working in the hands or feet? Or you can simply use little monofilaments, kind of like a fishing wire, that are specially calibrated to see how much you can feel. and see whether your sensation is decreased from normal levels. So that's a simpler, cheaper test that can be done. Typically begins between first and third cycles of chemotherapy, but again, can start right away, can start later. There's a lot of variety there. So that's not going to eliminate. So summary of just kind of these basic facts. It's really, really common. That one statistic stated 20 to 100% of people treated with platinum-based compounds. So, probably underreported, undertreated. Like Joette said in her presentation, if you're experiencing this, you're definitely not alone. It's very common. The other thing I didn't highlight in the last slide is it tends to be younger people. There's a lot of research about peripheral neuropathy in diabetic populations or just other populations that tend to be more elderly. But patients from 26 to 86, one study cited, can be affected by this problem. So again, pretty equal opportunity as far as that goes. And then just focusing on the functional things, it can lead to weakness. If you're not walking as much, lead to decreased fitness. If it's increasing your falls risk, can have fractures. There's all sorts of really serious consequences, as if having painful, tingly feet or hands wasn't serious enough. But the last point, and the most positive and encouraging, is that there are a lot of things you can do to help mitigate these consequences and to help make the chemotherapy-induced peripheral neuropathy less of a problem. Good, so that's kind of the end of summary stuff. We'll talk about strategies next, but does anyone have questions about sort of the basic summary information? Yes?
How long have you seen patients? How long does it last?
Varied. So it can just kind of go away on its own once you're done with the chemotherapy, but it can last for a very, very long time. And it can be more just management of, okay, we know that you don't feel your feet. Let's deal with that.
Is it permanent then?
It could be. It could be. It could be permanent was the question, and how long does it last was her question. Good. Anything else? Great. So this next slide is a lot of information and a lot of kind of technical therapy words, but the point of it, the reason I included it, is just to highlight when we're talking about being able to use your feet, postural control, orientation in space, the sort of basis of balance and ability to get around. There's all of these things that go into it, and the fact that it's so complicated and lots of things is very encouraging in that there are so many areas we can enter and do something about. So under that first section, strength, just even increasing the strength of your feet is going to increase your ability to sense and control your position in space, even if you're not feeling your feet as well as you did before chemotherapy. Movement strategies, so being able to react to things that are happening in the environment, the little crack that you didn't see and you kind of catch your foot, or being jostled by somebody in a crowd, whatever it is, that's something that can be trained and practiced. Perception, knowing where vertical is, these are all things that physical therapists have worked with in stroke patient, Parkinson patient for years and years and years. And a lot of the same strategies and treatment strategies apply in a chemotherapy-induced peripheral neuropathy. Working on gait, working on attention, kind of like Joette talked about, is going to improve. So there's lots and lots of ways to enter in an effect. So what are some treatment ideas? Well, I can promise you, you will look just like that if you come see me. I don't look like that. All right. So first of all, talking about the issue of pain tingling. Unfortunately, there's not as many different strategies for this as for balance. You'll see we have many slides about balance coming up. But the main thing that's being researched right now, and I will say there's other strategies that people use, but I'm focusing on the ones that have fairly strong evidence to support them for this talk. So there's quite a few studies, mostly in the diabetic neuropathy population, but it would apply in chemotherapy induced as well, talking about TENS units or electrical stimulation units as ways of changing the way the nerves are firing and sending pain signals, and reducing those pain signals or tingly signals. So I highlighted 2 studies here. There's many more. One using high frequency, one using low frequency. So different patterns, different types of this electrical stimulation. A rep just brought in a brochure for me the other day of a new one that's just a little strap that goes around one leg. It's supposedly affecting both legs, and you just kind of have this little strap, hit a little button, and you get these little tingles. There's a couple theories as to what it's doing. The most common one is that your brain can only process so many signals from those nerves, and so if you give these tingly signals from the machine, not as many pain signals can get through, and you kind of settle things down, have less pain, even after the machine is off. So otherwise, a normal one is 2 or 4 little stickers that you kind of put on the part of your leg that's painful or the part that you can still feel. You turn on the machine, you can kind of hook it to your belt and just walk around with this device on your leg. So that's something that is a prescription from your doctor issued by a physical therapist, but then you just have it at home and use it as you need it. So it's worth a try if the pain or tingling, these sort of sensory symptoms are what's preventing you from walking, doing whatever you want to be able to do. Balance. So if, it's tingly or I don't feel it as much, but the main problem is just not trusting your feet, not knowing where they are in space, or not doing as much and then feeling like you can't do as much. There's a bunch of different strategies that we use there. So one particular set of strategies is doing an exercise program for your feet and legs. So simply strengthening the muscles of your feet and legs, which has 2 purposes. One, to strengthen the muscles just in and of itself. You're going to have more control if you're stronger. And secondly, just increasing your awareness of your feet by moving them and drawing your attention back there rather than saying, oh, it's tingly or I don't feel it as well, I'm just not going to use my feet and legs. So this, again, there's a bunch of different studies supporting different exercise programs. This is one that we've pulled out within the STAR program and that we're using. We feel like the evidence was good enough. So I actually have it listed out on the next couple slides. So having people just go through this exercise program, starting wherever you're at, 10 repetitions, 20 repetitions, increasing your number of repetitions, or decreasing the amount of support you need from your hands so that you're increasing the balance required. So ankle alphabet, sitting down, just writing out the alphabet with your feet. You're doing lots of different motions. You're strengthening the muscles around your ankle and your foot. You're thinking about your foot, drawing your attention there. So going through the alphabet, each foot. Standing heel raise. So you're just going up on your toes, strengthening the muscles of your calves. Again, working through your foot. Maybe it's tingly, maybe it's painful, but you're just getting normal motion through the feet. Lifting the toes, going back on your heels. Again, working the muscles in the front of your shin, I guess it's called. Lateral weight shifts. So seeing how far can I sway? Where is the edge of my foot? Can I feel that? Can I, with support from my hands, can I figure out how I can still balance, but yet have my weight shifting from one side of the foot to the other? Then doing those three things on one foot, which takes more balance, takes more strength. And a lot of times I'll use these three as a progression. Once you've done well with the 2 feet, then you can go on one foot, maybe with support, maybe without. Up on the toe, up on the heel, and then shifting. I don't know if I can even do this right now. Side to side, where are the edges of my foot? And I do that on one foot. Wall slides. These are sticking. Just strengthening lower legs, strengthening quads, up and down here. Again, just more support, more control through your legs, and then just balancing on one foot. What better way to practice than doing the thing that's hard? So I really like this program. I feel like people can learn it pretty quickly. You guys can even probably just do this from the handout that you got, and increasing strength, awareness, movement through the feet. A simple strategy to use at home just to kind of start from doing that snowball of doing less, feeling like you can do less because feet are not responding in the way that they were before treatment. So there's a lot of other pieces of equipment that have been researched that can be helpful. So some clubs will have the Bosu ball, that kind of half ball, or the BAPS board is another sort of wobbly board thing that you can, just ways of challenging your balance, standing on foam, they've done studies about these different things, that actually doing something that's hard in a safe way will increase your balance in people with, again, this is diabetic peripheral neuropathy research, but it's a similar mechanism with the nerve being injured peripherally, that you actually improve your standing balance control. So is the nerve necessarily going back to normal? Maybe, maybe not, but you are using other strategies, using your muscles, using your proprioception, your sense of position in space at your knees maybe, or your hips maybe, and using other strategies to improve your balance, control, and confidence. Oh, the Wii Fit. Yes, so there's also a study about the Wii Fit. If anyone has that at home, there's a balance board on that. That's one that's a little more common for you just to have, perhaps, sitting around. But it's scientifically proven that it can be helpful. So, way to go, Wii Fit. And everyone tolerated it well. I liked that part of the study. They liked the Wii Fit. So they improved their static and dynamic balance. So ability to balance while you're standing still, whether they did on one foot or one foot in front of the other, and dynamic. So when you're walking around a lot more functionally. They improved both areas using the Wii Fit balance board. Next topic is this orthostatic. Oh, yes.
So what strategies do you have for numbness in the fingers and arm pain, that kind of thing?
I was just realizing that as I was talking that I didn't really include a lot of strategies. And the reason for that is because at my clinic, we have a hand therapist who's an OT. And so we have sort of split out the hand and the foot in that way. So even at this moment, Why did I skip that? But the same sort of principles would apply. The more you strengthen, use, draw attention to, the more dexterity you're going to have. So I don't have anything specific, but I think you can use the same principles of, instead of avoiding, using the hands, using, moving. You could certainly do finger alphabets, things like that. So I apologize for that. Any other questions before we go on? Yes?
Are there certain kind of shoes that would be sturdier when you're doing these type of exercises?
I actually have people take off their shoes often because the point... Oh, I'm sorry, yes. Any specific type of shoes that I would recommend. So I often have people take off shoes because the point is to get as much awareness of your foot and how it's moving as possible. If that's really uncomfortable, it's going to be a really individual thing. And for a lot of people, that is uncomfortable. So I would say, if tolerated, having no shoes so that you can feel the ground and really be aware of your feet. If not, it tends to be kind of a trial and error of what shoe is most comfortable for you and provides the support. The one thing I will say is the rocker shoes do not. So a lot of times people will try those because they're not doing well balance-wise, and they make it even harder for you to balance, so it tends to be a really bad idea. Yes?
This may help the lady that was asking about hands.
Yes.
Prior to my cancers, I've had spine surgery, and I was at the Kennedy Institute afterwards, and we did what we call desensitizing with different fabrics, and I found that we went through wool, flannel. I ended up with terry cloth, so I rub my legs with terry cloth, and that helps. But I also am a piano teacher, and so I started, this last round of cancer, I started getting it in my fingers. So I've used the terry cloth just to rub on my fingers, or rub my fingers against the terry cloth, and that seems to help with the neuropathy or the tingling too.
Yeah, exactly. So just so everyone can for sure hear, she had experience with desensitization using different fabrics. So starting with something smoother and moving to a rougher item like a terry cloth. And she's done that both on her feet and on her hands. Is that a fair summary?
Yeah.
Okay. Yes. And I guess that's the idea with the bare feet too, is you can use different types of floor, and just increasing your awareness is going to help settle down and normalize those signals that the nerves are sending. Great. Yes?
A couple of weeks ago, I've had neuropathy in my feet and my hands too, but I had a mani-pedi for the first time, and it hurt. It's as I was just scrubbing on my feet and stuff. That really hurt. And going up my legs, it's just like, wow, I couldn't believe how painful that was.
So she was just sharing that she had a mani-pedi for the first time, and it was really, really painful. So you can imagine if you're going through this progression of a softer fabric to a terry cloth, washcloth being hard, you go to a pumice stone, or I don't know what they were using. That's a pretty extreme jump. So you might want to start with, just a softer cloth first of all. But yeah, interesting. Yes?
Can you speak to your experience with using acupuncture for these symptoms?
So I don't personally have a lot of experience, and I didn't highlight studies, but there's a lot of evidence coming out about acupuncture and the way that it does decrease pain. I don't have anything specific to add. Do you?
No, but I'm contemplating it.
Okay. Yeah. Do you want to add something about acupuncture, Noelle?
I have had patients that I have referred for acupuncture. It is a great modality to use during your chemotherapy and afterwards. It may not be the first modality that you use for, to treat the pain or the symptoms, and certainly not the balance aspect of it or the functional deficits, but it can be a great adjunct for a number of reasons. It can help with anxiety, mood, generalized pain, generalized fatigue. It's been used for nausea. And a lot of insurance companies are covering acupuncture for pain. So I think it's reasonable to try acupuncture at some point. But it is, we try to prioritize as well the whole picture of what we're trying to treat. Because it is another appointment. Oftentimes they want you to get acupuncture a couple times a week for a number of weeks. So depending on your schedule and your energy, what all is going on, I think it's a great thing to talk to your provider about.
Yeah, good. So, sure.
A couple of things. I did try acupuncture. It worked for me. It's worked for some of my friends. It has not worked for other friends. And it depends on the person you have doing the acupuncture to and the type that there is. So, but I did have another question. Is there a time of day that people seem to have where the neuropathy bothers them more, like where they wake up at night from it?
Yes.
Trouble sleeping.
Yeah, I wouldn't say, so first of all, just to summarize, she tried acupuncture and it did help, but she's had other friends that it didn't help. So anyway, personal testimony. And then her question was time of day. Is there a consistent time of day when the neuropathy is bothersome? Yes, I would say, or a lot of times people do complain about it at night, waking them up, and that's a huge functional problem. As Joette talked about, fatigue, getting good sleep is hugely important for healing, mental health, all these things. But for different people, it does sometimes seem to be related to fatigue also. So if everything else is kind of overwhelming, then the neuropathy is also more overwhelming, of course, at that time. So that would be an individual thing. Yes?
I just thought of one thing. I work with kids with autism, and we brush them, and this is something you might know more about. Do I brush them for their nerve? Would brushing help our neuropathy? Like if we got those?
Sometimes it does.
It does?
Yeah, so her
Because I
question...
worked with
What kind of
kids.
brush?
You might explain what kind of brush, because
Yeah.
I don't know what they're called. We were provided with the brushes, so
Okay.
I don't know.
Yeah. So her question is talking about in working with children with autism, sometimes there's brushing that happens just to sort of decrease sensitivity or settle down. And would that work in this situation? And I think that would fit right in with what the lady in the chat was talking about of this gradual progression of desensitization using a soft cloth, and I would think that the brush would come in maybe after the terry cloth. But the theory there is that it's kind of like what we were talking about with the TENS. There's all these signals because the nerve is damaged. There's too many signals, pain signals that aren't preventing you from, pain is supposed to prevent you from harm. You put your hand in the fire, it's painful, so you get it out. When there's damage to the nerves, you're getting pain signals that are not helpful. And so the more we give it normal feedback, just this is normal touch, the more, because the nerves and the brain are plastic, they're changing all the time, the more feedback you give the system as to this is normal touch, this is okay, and then grading that so you're not jumping past your tolerance level and scraping your feet with a pumice stone when you can't handle a soft cloth. But you're just kind of sneaking up on that system of, okay, this is okay, I can tolerate this. Now we're going to make it a little rougher. I can tolerate this. You settle things down. And you experience that in your life every day. You put on a shirt and you feel that you're wearing a shirt, and then your body sort of forgets about it. It gets used to, it sort of stops sending the signals because they're not useful. And in disordered or when the nervous system is damaged, we have to do more to get that settling down to happen. Yes?
It's sort of bringing both of your things a little bit together because I have a lot of neuropathy in my hands and stuff. And when I'm trying to like curl my hair, I have to stop and think, take breaths, and then do it, because otherwise I do also have tremors, so I burn myself a lot. So you have to like watch with your eyes. You're using, bringing in your other senses to make yourself more aware of what you're doing. And then do the activity, and to wait that 15 seconds, like she said, that it really makes a huge difference.
Yeah. So she's bringing in Joette's idea of pausing or slowing down, bringing your attention to the activity, talking about having neuropathy in her hands and experiencing burning when she's curling her hair. But when she uses her eyes, uses her attention, rather than just kind of relying on the sense like you normally would, that it goes a lot better. So yeah, that's a great bridge between kind of the cognitive strategies and the peripheral nervous system, which of course they're connected. You know, your whole nervous system is connected, controlled by your brain, so you have a lot of power to use different strategies and put everything together. Maybe you can't rely on your touch, but you can rely on your vision. You can rely on motor planning. You can rely on the mirror, whatever other strategies you need to use. Good. Yes?
Would wearing compression stockings help?
It might. That would fit in this same category of the desensitization, so it would depend on tolerance and where it would fit in that. So if you can't tolerate brushing your leg lightly, the compression stocking might be too. Her question was, what do you think about compression stockings? Sorry. So that might be too much pressure. They tend to be a little rougher. But if you're at that level, it might be a helpful desensitization tool. Yeah, do you have anything to add, Noelle, about compression stockings?
I have found mixed responses to compression stockings. We sometimes, I have had patients say that their legs feel better when they're in compression stockings, but if there is significant neuropathy, pain neuropathy, it can limit our options for compression stockings. So I have had experience with both.
Yeah, I've definitely worked with a couple people who just the idea of anything squeezing or touching, there's been a lot of issues with shoes. Again, I work with feet. So shoes touching or rubbing and just not wanting anything tight. But, yes?
2 years ago when my neuropathy in my feet was at kind of the peak, I still have it, but it's not so bad. I found that acupressure or reflexology foot massage really helped. I couldn't stand if they just barely, like if you went for a pedicure and they were just kind of touching your feet, but when they did the reflexology, that seemed to really help me a lot.
Okay. Yeah, so again, she really liked reflexology when she had more symptoms from neuropathy. Didn't like light touch or brushing, but liked that deeper pressure. So probably might have liked acupuncture as well.
The thought of the needles, I'd had acupuncture before, but the thought of the needles going in, I couldn't stand it. The reflexology.
Okay, great. Yeah, so another treatment idea to try again.
I think
Yes.
it's important too to figure out what you're doing when you're having neuropathy in your hands. Are you bending your hand like this? This would maybe be more of the girl issue than anything else.
Yeah. So bringing up the point of what are you doing when you're really experiencing neuropathy, because there's a lot of other things that can affect your peripheral nerve too. So if you're tensioning through your ulnar groove, you're tensioning the nerve. And that's a good point as well, that there are other things. So the neuropathy is usually the whole hand. If you're experiencing symptoms of just a couple fingers, could be carpal tunnel, it could be ulnar groove tension. There's a lot of ways for your body to get upset when you're going through all of these treatments. But yes, strategies to just keep the nervous system in a loose position as well is a really good point. Yes.
Is there just
is there a certain way one should brush, or how do we treat the nerves? In what direction?
Oh, so going back to this idea of desensitization. So if you're doing the brushing or the rubbing, do you need to move in a certain direction? I don't know. I don't think you do, because the idea is just settling down. So I've actually had people do more circular. I'm sure there's a theory out there, and I won't say for sure. Anybody who's had experience with this been told to go in a particular direction? Okay. Yeah, because you're just generally trying to settle down the disordered firing pattern.
I find
Yes.
with the kids, they let you know which way. We're taught to brush downward,
Okay.
but they will let you know that, no, up, so you change,
Sure.
or like they really want their fingertips done. And it's all nerves too. And they will actually put their fingertips into the brush really hard. So you kind of, you might know if you get, and this brush is very soft. It's plastic and it's little. It's almost like a foot brush, you know how they sell those little foot brushes, but it's different. I would definitely get one from, I don't know, do you sell them at your place, or where would you buy a brush?
I really have very little experience with the brush.
Because our therapist gave us these brushes.
Interesting.
But I think you'll know where you need to just keep working with it. Because they let us, and they can't speak. A lot of them don't have language. So they'll just tell you where to go.
Yeah, so
Even though there's a technique.
Yeah, so she's saying in her experience working with children with autism, it's very individual, that they have their preferences as far as what they want. And I think that that's what is, the research that I do have on these TENS protocols, which again is similar to the desensitization that we've been talking about. You can do it with the electrical stimulation, you can do it with physical stimulation. The studies are showing that you can do high frequency, you can do low frequency, that it's really individual for the person. Yes?
Do you have any knowledge or evaluation of the real laser treatment system?
No. So her question is, do I have any knowledge or evaluation of a laser treatment system? I don't. Yes?
You're talking about the relief? Yeah. I don't know if there's a lot of data on that program, but we have had some patients that have had good luck with that, with pain relief with that system. We are aware of it. Dr. Hutchison is aware of it. So it is something that people sometimes suggest, but again, it is a cost, and I don't believe that it's covered by insurance. So, we're always trying to be as honest as we can and as effective, and,
There is going to be a trial started at the University of Minnesota to evaluate your gynecologic patients who have bone marrow.
That's a good system, but I think, I think the idea, it's not similar, or it's not the same, but with the TENS unit, tricking these nerves, trying to get pain relief through that way, it's sort of the same, not really, but, I would definitely try a TENS, but the relief, is a good system. We have had patients that have. And do you remember how to spell it? Is it?
Yeah, I just looked it up. And it is available around.
Right.
Here it is REALIEF.
Yeah.
REALIEF. Oh, like relief.
Like relief with the A. Like
Oh, real leaf. So just a little discussion about a laser, which is yet another kind of alternative pain relief strategy. Yes?
Okay, my wife tried that, and she didn't get a lot of relief from it, but talking to other people in the waiting room who were also taking that treatment, many of them said they definitely got relief.
Mm-hmm. Yeah, and I think that's going to be, so he's saying his wife didn't get relief, other people in the waiting room did get relief, and I think that's kind of the take-home message we can have from all this discussion, that when we're dealing with interesting nervous system firing patterns, it's going to be really individual. Something is going to work for somebody. It's not going to work for other people. We're doing more research. We're going to have more information about what the statistics are on some of these things. But for now, there's a lot of different things to try. Noelle.
And there are medications as well, specifically for nerve type pain. And it would be a good idea to talk to your oncologist about them. Gabapentin, certain antidepressants can help with peripheral neuropathy as well. Again, it's a decision, a cost-benefit discussion about adding medications, but certainly a lot of times for people that have that nerve pain at night, even adding medication just at night can help relieve some of that pain and help you sleep. So there are medication options as well that are specific for this.
Yes, thank you, Noelle. So just bringing up the point that there are medications as well to treat nerve pain. Good, great discussion. Anything else? One more? Yes, Carol?
I've been trying an inexpensive therapy my friend with MS recommended, and I've been walking in a plastic vat of rice, which simulates walking on the beach. And I think it's helpful. But I was really sore at first, kind of like what she said with her pedicure. At first I thought, whoa, this is too much. But I think it's helpful.
Yeah. So one more home treatment idea, and this is used a lot of times with occupational therapy with hands. So that's another hand treatment idea too, but she's been walking in a vat of rice. So a lot of times the occupational therapists will have people put their hands in rice or different, you can do different textures of things, but again, it's finding that level where you're tolerating it, not tripping the system and creating huge amounts of pain and then progressing. All right, one more.
Okay. How about going barefoot?
Did you find that on Amazon?
Would that be helpful or detrimental?
So again, it's an individual thing, and it depends where. So our question is, how about going barefoot at home? If it's causing you huge amounts of pain, then no. But if it's just a little bit uncomfortable and your home is safe and you don't have plywood subfloor or something, it's this idea of giving more information, giving more normal feedback to the nervous system. So it's going to be an individual thing. It might work for some people. It also kind of depends upon other orthopedic issues with your feet. Some people need the supportive shoes and have trained for 60 years to always have supportive shoes, so bare feet isn't an option. But I wouldn't say in a safe environment where you're not going to step on a nail or something, a lot of times people will never do that. If it's safe, it's okay to give yourself the extra feedback. Yes.
Amazon has the sensory brushes. I showed it to her.
Excellent. Amazon has sensory brushes. So they're called sensory brushes. And they're on Amazon. How much?
6 for $16.
$6 for $16. Okay.
Yeah.
So form a pool.
Or 12 for 22.
I don't think you really need 6 of them. I don't know. Okay.
I'm sorry.
Yes.
I just want to keep us on track.
Yes.
5 more minutes.
Yes.
I
Yep.
want to make sure you have time.
Yes. Yeah. We're actually doing pretty well. The last couple slides are quick. So that's great. So this next one is again just talking about this orthostatic hypotension. The idea is that as you're sitting up, blood is flowing down and your brain doesn't have enough and you can faint. So I put this in there because it's so quick and easy, and in the study, 0 people fainted when they did this. So basically, before you sit up, so you're kind of using all the muscles of your arm. You're pulling your arms away from each other. You're squeezing with your hands. So you're using shoulder muscles, using biceps, using your hand muscles. So you're just kind of pulling blood into upper body muscles. We had some discussion of this, I would say, somewhere between 5 and 10 squeezes before you sit up. So if this is a problem that anyone's experiencing, it's a fairly quick and easy solution. Kind of like some of Joette's strategies, taking extra time to say, oh yeah, I know that this happens, I'm going to use my arm muscles a little bit, then I'm going to sit up and feel either less dizzy or not faint. So gait strategies. If you are having pain in your feet, not feeling feet as well, tingly feet, sometimes using an assistive device can be really helpful. Just having that extra support of a cane or a walker takes some of the pressure off and gives you just a wider base of support. If you're young, active, consider walking on a treadmill or running on a treadmill so you have the arms. Then you don't have to be using a cane or a walker, but you have something there just to give you that extra stability. So considering, what is it going to take for me to continue walking, to continue being active, and be open to changing things a little bit or using a device to help you, walking sticks, different things to just give you a little more feedback from different areas of your body. And then just strengthening, part of the whole peripheral neuropathy exercise program, but also it's going to help your gait, it's going to help your balance, strengthening core muscles. If you imagine being able to control your trunk, having strong muscles there is going to help with your control of your body in general. So concluding, lots of people in this room are affected by this problem. Maybe up to 100% of patients with certain chemotherapeutic agents. It may go away on its own. We addressed that before. But there are also lots of things you can do to try to make it less of a problem. And then just remembering, Joette mentioned this, I want to mention it again, fitness. So much research is coming out saying that fitness improves survival, that fitness improves quality of life, decreases any sort of side effect you can come up with of the treatments, of the cancer, of whatever. So anything you can do to break down barriers to walking, whatever exercise of choice that you have, that is very, very important. That's all I got. Do we have time for one more question? Okay.
You were talking about the TENS machine, and I know I've used it for my arms and stuff
Sure.
too. I know you can get them online, but is there anywhere local you can get a TENS machine?
So our question is there anywhere local you can get a TENS machine? You can get them online. We obviously have a vendor that we use and we issue them, and they're these high-end units that come with a great warranty, and we've been convinced that that's what you need to do. So anyone else have any information? So that's the only thing I've experienced with.
Yeah.
No? Noelle?
I would just say that the great thing about working with a therapist and your physician, is that you can have a trial in physical therapy before spending the money to get a TENS unit, on your own. And that a lot of times is the same thing I tell people with compression garments. Working with your provider first, working with a vendor first, it may cost you more initially because you're having that. They do, provide a service for you, and down the line you may be able to, order these things on your own online or, independently. But because with the physical therapist, you get, trial and error, you get some time to work with it, what setting is going to work best, what strengths do you need, what time of day, different things. So I think it's great to use other resources, and certainly that vendor is not trying to monopolize, but there is a benefit of working with a number of different people for that trial period too.
Yeah, I guess the other thing that people have come up a problem is with the patches. They can get expensive, and that's an ongoing expense if you do the TENS unit on your own versus if you bill it through your insurance. which often coverage is pretty good. Then you get the patches forever, your warranties forever. Plus you get to actually work with somebody to figure out how it is used best. Okay. Great. Well, thank you so much for all your questions and participation.